Hello, hi, I'm Mudaly, the convener of the team that wrote the report relating to the South African government education sector responses to COVID-19. This presentation was put together by myself, Mudaly, and Ronika Mudaly. I must say that the school and university closures have been amongst the most shocking signs of COVID-19's power to drive a global shutdown. The effects of COVID-19 on education will certainly be felt for many, many years to come. And much of the report that we've written was centered on what Marie Curie once said: nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less. And the idea about writing the report was so that we could prepare for future pandemics, or future disasters, and so on. So when we wrote the report, it is quite in depth, but we took into consideration the kinds of things one should do in preparing ourselves for future disasters and pandemics. So amid the competing voices from many stakeholders, the ministers had to make unprecedented, complex policy decisions, including the closure of schools and the move to online learning. But such decisions brought existing educational inequity and inequality into sharp focus. For example, the digital divide meant poorer learners had little online learning, little access to online learning. Also, the new liberal idea of homeschooling was imposed on parents, many of whom lack educational capital themselves. When a phased reopening of schools was announced, measures were taken to contain the spread of the virus. Curriculum content was decreased, and different timetable options were made available. The reopening was not without challenges. More middle class than working class learners returned to school, and financial constraints in some schools and institutions of higher learning made complying with the COVID-19 protocols impossible. That said, the education sector achieved significant successes in implementing mitigation measures during the pandemic. The risk-adjusted phased return of students, intensive collaboration with stakeholders to inform policy decisions, and the provision of data and devices for online learning were exceptionally crucial. Whilst the cost of the pandemic in terms of human lives has been catastrophic, the havoc it is wreaking on education may be felt for many years to come. For example, the pandemic has severely tested the already stressed funding for education. This is a particular concern, as despite occasional claims to the contrary, the best evidence suggests that the quality of education is also responsive to financial resources. The months of tuition lost may never be recouped. Furthermore, lengthy breaks in learning affect the quality of education. When learners and students are away from classes, they begin to forget what they have learned. It has been anticipated that over 80 days of learning were lost in 2020, and learners' a priori knowledge would decrease and might have to be recapped when schools reopened. The full effects of these interruptions may only become clearer many years into the future. It has exacerbated inequalities in education. In low-income countries, the rate at which children complete school is twice as high amongst wealthier than poorer families. About 35% of primary schools lack basic infrastructure for hand washing. About 500 million students cannot access remote learning, according to the UN in 2015. These inherent inequalities create deep divides in the levels of learning available. During the pandemic, some wealthy students could keep learning unhindered, while others could not learn at all. Without continued investment in education, the gap between the haves and the have nots will widen further as wealthy families purchase educational opportunities for their children that leave other students behind. Learners in poorly performing schools in South Africa already fall far below international norms. The pandemic exacerbated this problem and deepened inequality. COVID-19 is disrupting children's education, learning, and well-being in substantial ways. The United Nations distinguishes three channels through which these effects may manifest. The first one is infection. Children seem relatively less susceptible to the virus than do adults, possibly because they have fewer comorbidities. In South Africa, over a third of the population is under the age of 18. A laboratory confirmed COVID-19 statistics show that from March to September 2020, children comprised only 18% of all cases and 3.2% of admissions to sentinel hospitals. The cumulative incidence of COVID-19 was 6 times lower among children than adults. Secondly, socio-economic effects of the virus and related measures. According to the United Nations, while children are not the face of this pandemic, its broader impacts on children risk being catastrophic and amongst the most lasting consequences for society as a whole. The, the African Child Policy Forum concluded that although children are not as widely infected by COVID-19, they are disproportionately affected by the socio-economic impact. Children are at risk not only of infection, but also of losing or being separated from family members and caregivers. Children also face worsening poverty and inability to access education and social isolation from their peers. When schools shut down, education came to a halt for financially deprived learners. Girls bore the brunt of care work and domestic labor at home, and children were more vulnerable to multiple forms of symbolic and substantive violence and crime. Some were also deprived of meals. Many learners were further peripheralized materially, spatially, linguistically, and culturally. Longer-term efforts to achieve the Sustainable Development Goals to ensure the realization of the rights of children. This relates especially to SDG 4, which aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Restricted access to schooling and finance for education during the pandemic undermines the global prospects for the development of children. In South Africa, existing fiscal constraints have been exacerbated during the pandemic, severely affecting children and young people. Also, extreme inequality means vulnerable and disadvantaged children will still bear the brunt of this educational disruption now and in the coming years. Those from impoverished backgrounds have inevitably fallen behind. We can conclude from the evidence available that a low number of infections will occur in schools. So the education sector has achieved some significant successes in implementing mitigation measures during the pandemic. Highlights include the relative ease with which some schools and post-school institutions transitioned into online and blended learning modes, and this is commendable. Secondly, the close collaboration between the PSET sector and higher health, and at school level, between the DBE and the Department of Health. The education sector adopted a risk-adjusted, differentiated phased return of students and learners in reopening educational institutions. Fourthly, the curriculum trimming and the reorganization of the timetables. Sixth, on-site visit to educational institutions to inform future decisions. And this was good because we've seen ministers, we've seen the deputy ministers and other officials visiting schools and higher educational institutions to do on-site visitations in order to assess what was going on. That was exceptionally good. Seven, provision of data and devices. Eighth, supporting and training of staff and students to adapt to different modes of teaching and learning. Nine, the successful completion of most first semester sessions in most PSET institutions, albeit using online technology for teaching and assessment. And we must say that there was successful completion of even the second semester sessions in all PSET institutions. We have not had any reports of the non-completion of any semesters at any of the institutions. And then, of course, 10, no large-scale infections reported in educational institutions in general. So that has been a very positive sign. However, the implementation process also resulted in challenges. Vulnerable children and students from low-income families were most affected, and they were affected in many ways. Reprioritizing of state funds for COVID-19 for 2020 and 2021. We were not sure how these funds were actually being used in the education sector. We do believe that some of the funds were moved away from education and reprioritized in other sectors. Most parents are not trained to teach, so we anticipated that some homeschooling will take place, but our parents were not in a position to actually conduct homeschooling themselves. Social distancing with large classes, we do note that many schools took the task of separating learners into two groups, a morning session and an afternoon session, but we do believe that some classes were exceptionally large and that became still difficult to socially distance, but schools tried their utmost to comply with social distancing. The unavailability of PPE, we note that in the initial stages of the pandemic, schools indicated that they were struggling to obtain PPE, and during the course of the year, schools were running out of PPE material. Teacher and lecturer burnout. With the change in the delivery of lessons, teachers and lecturers had to then change the mode of delivery, and this created intense pressure on teachers to redesign their delivery in ways that were not normal, and this ensured that teachers and lecturers had to burn the midnight oil, which resulted in a lot of teacher and lecturer burnout. And of course, the holidays were used in preparing for the weeks to come in the future. Private school closures, communication between departments of education and institutions, learners, students, and parents and staff were not always adequate or effective. So the point that we're making here was that the communication systems that were being used was at most times not sufficient. Parents didn't know what was going on, learners didn't know what was going on, and I think this was part of the learning process that we had to go through. And I know that for the future, this is something that we will have to highlight. Preliminary lessons continued. Even at this stage of the pandemic, several preliminary lessons can already be identified. In terms of the Department of Basic Education, the school infrastructure has to be upgraded in terms of water supply and so on. There are huge gaps in our schools where infrastructure has to be upgraded, and this is absolutely necessary at this stage in terms of the classrooms as well, in terms of the desks that learners have, in terms of the furniture, in terms of various aspects of schooling itself. This needs to be upgraded. In terms of ICT infrastructure in schools, these need to be upgraded. If teachers wanted to conduct online classes or they wanted learners to learn using computers and so on, schools don't have these facilities available. Well, some schools do, but the majority of schools did not. And I think that needs to be upgraded. Connectivity, we sense that connectivity is a major problem throughout mainly the rural areas, and this needs to be worked on. Mobile Wi-Fi hotspots should be established in villages, towns, and cities so that students can access information without traveling great distances. We still have, up to this point, students either sitting in their cars or driving off to a particular point in a town or a village in a particular spot, sitting in the cars and then listening to lectures or lessons and so on. I think we have to work within villages and so on, where we can identify hotspots where students can assemble and work from that spot. Health education has to be improved in schools. This idea that we now start to teach children that they need to wash hands and maintain, good hygiene should have been something that has been ongoing for a long time. Health education should be part and parcel of a curriculum, not a reactive process. Community centers and libraries must be upgraded so that our learners and students do not find themselves wanting. They should be able to get to these centers quite easily. Continuous teacher professional development, especially in terms of the kind of ICT infrastructures, the ICT usage, online teaching, and so on, the kind of software that we can use, that needs to happen. Continuous teacher professional development needs to take place. The improved communication among stakeholders, we need to ensure that our communications from schools to parents, from the department to schools to parents, all of these things need to take place in a way that will ensure everybody's on board with the changes that are taking place. In terms of the Department of Higher Education and Training, based on the Department of Higher Education and Training COVID-19 pre-disaster and disaster management report of 28th April 2020, the following observations can be made. Coordination, communication, planning, teamwork, and swift implementation of the COVID-19 measures were critical elements of the DOET's response and remain vital during the pandemic. We must say, in conducting this research, that the Department of Higher Education reacted very well in the way universities and higher educational institutions got back to a sense of normality where students were not left too far behind. The DOHET has made significant strides in safeguarding students while also saving the academic year. The capacity and capability of educational institutions are uneven. Of course, we do understand that not all universities, higher educational institutions are similar and could conduct the online teaching in a similar way. Some institutions struggled a bit, and perhaps we need to get to the stage where we can ensure that all institutions are on par. The DHET noted the number of foreign students who returned to their home countries at the start of the lockdown and the need to deal with the modalities of their return. It was something that one could not have preempted, but it is noted that something that we need to look at for the future. Some late developments, of course, return to ECD centers after the level 5 lockdown was slow. By August 2020, only 13% of children aged 0 to 6 years returned to the early childhood development centers. The reasons were that many ECD centers could not comply with COVID-19 regulations and therefore did not reopen. And this is great concern. Many parents believe that most of the year had passed and elected to retain their children at home. Some parents expressed the anxiety about their children's health during the pandemic and kept their children at home. Several ECD centers had to retrain staff or close completely as a result of low return of learners. In 2021, it was reported that the Early Childhood Development Employment Stimulus Relief Fund was created to sustain employment in the ECD sector, which was good and important, I think. In May 2021, due to a new upsurge in the spread of COVID-19, the DBE announced that contact sports were suspended. And this is something that happened over the last few weeks. Non-contact sports were allowed while maintaining social distancing and hygiene. The outbreak response team is monitoring the situation. We understand that certain parents are not very happy with the decision, but with the possibility of third wave, the Department of Basic Education has now decided that contact sport should be suspended. Some of the early recommendations: the unprecedented COVID-19 crisis has presented the education sector with a unique opportunity to show the departments of education, schools, and higher education institutions can and must do the following: adapt to the changing teaching and learning environment. So adapting to the changing learning environment ensures that we're not only adapting because of the pandemic, but we're adapting as a result of the fact that we are in the fourth industrial revolution as well. In the long term, transform the status quo, which relates to socio-economic and digital divides in South Africa. Provide all learners and students with tools to handle future pandemics and other crises. And we don't mean with regard to technological tools, but tools, other tools to handle these pandemics in terms of knowledge about hygiene and so on that are crucial for students to know when such crises, are experienced again. Develop programs to address the lost teaching and learning time and mitigate the effects of missing curriculum content. We should have plans in place which states that in the event that time is lost, that we will revert to another curriculum. So instead of during the course of the year and when the crisis then surfaces, that we're now struggling to find out how we would then adjust the curriculum. We should have an alternate curriculum already at hand that will be implemented instantly. During lockdown periods, maintain contact with learners and students. The PSET sector was generally successful in maintaining an online presence. The school system, however, needs better ways of online teaching and learning. Rather than wait for the next crisis, it should start developing structures and methodologies to help educators and learners engage with innovative strategies. Develop effective communication systems to avoid confusion and ensure that all are fully aware of the policy, procedures, and actions to be undertaken. So we've got to use every community radio station, every community newspaper. We've got to use television. We've got to use every source available to us to communicate to parents, to learners, informing them of what we are doing. We've got to ensure that decisions to close or reopen schools are not driven solely by health considerations. Example, the mortality or morbidity among children. People's needs, especially those in vulnerable, high-risk settings, should be an equally important consideration. I mean, we can't close up because we think children may become infected alone. I mean, we've got to think about the fact that children may also die at home as a result of abuse. So these are other considerations that one needs to be taking into consideration. Rethink the meaning of learning. In the pandemic, learning was equated to curriculum coverage. However, it transcends the curriculum to include socializing, interacting with peers and teachers, and developing skills for cooperation, teamwork, critical thinking, problem solving, and so on. And so this idea that learning is only about acquiring some knowledge and completing the curriculum was problematic. And we need to think about how in these crisis situations, we can try to incorporate other means. I mean, we can use online learning. We can use Zoom sessions, for example, to encourage socializing, for learners to interact with peers and so on. These are all available using online technology. If social justice is to be a central figure of offering quality education for all in times of crises, decide how this should be achieved. We need to ensure political will to drive sustained investment in quality education and healthcare so that institutions can weather the effects of disasters. An important learning point from the pandemic is that the departments of education should assess the preparedness of educational institutions to operate safely under difficult conditions. This should include the availability of sanitizers, PPE, cleaning agents, and cleaning and screening personnel. More importantly, the assessments of infrastructure must include the teaching and learning environment. Are teaching staff safe? Can institutions manage with the current number of staff, or should more personnel be deployed? What happens to institutions when those with comorbidities remain at home? Could certain institutions share resources and infrastructure? Could spatial limitations around safe distancing be addressed by sharing spaces among different schools? Could teachers from some schools be sent to others where staff may be older, for example, and there may be fears around comorbidities? As a final recommendation, the decision to close educational institutions and continue with learning at home must consider the spatial, infrastructural, and socioeconomic disadvantage, which is the lived experience of a majority of students. I thank you.